Growing allied health practices rarely have a revenue problem. They have a reconciliation problem. The work is being done, the money is arriving in bulk, and nobody can prove all of it arrived. If you run a speech pathology, OT, or physio practice with more than a couple of clinicians, the next 4 minutes are about the bookkeeping that keeps you paid in full. A group practice juggles 4 revenue streams, and each one leaks differently. NDIS funding arrives through portal claims, plan manager invoices, or participant invoices, and leaks through late claims and wrong line items. Medicare arrives as bulk deposits covering many sessions, and leaks when nobody matches deposits back to individual sessions. Health fund money arrives in batches that never quite equal the bank, and rejected claims quietly never get resubmitted. And private fees leak the old-fashioned way, unpaid invoices that nobody owns. Every one of those leaks is invisible in a file that just reconciles the bank. The deposit arrived, the software matched it, everything looks fine. Whether it was all the money you were owed is a different question, and it's the one that matters. The NDIS layer deserves special attention. Claims for agency-managed participants must be lodged within 90 days of the end of the service booking. Miss the window and the practice generally wears the loss for work already delivered. The fix is a monthly reconciliation between your practice software, the portal remittances, and the bank, so every delivered session is claimed, every claim is paid, and every rejection gets reworked while it can still be fixed. Then there's GST, and here's the trap. Health is not simply GST-free. Most clinical services qualify, but medico-legal reports, some third-party assessments, supervision sold to other providers, and product sales may not. Coding everything GST-free because health is GST-free is one of the most common errors in practice files, and it surfaces at the worst possible time during an ATO review. Now the growth number almost nobody has, utilization. When each clinician's delivered hours are visible against their available hours every month, hiring decisions make themselves. A team sitting at 90% utilization is leaving referrals on the table and can hire with confidence. A team at 60% has a booking problem a new hire would only dilute. This number falls straight out of books structured to track revenue per clinician. Very few practices have it. All of them could. One caution for networks. Once total wages, including some contractor payments, approach your state's payroll tax threshold, how your practitioner agreements are structured and recorded starts to really matter. The contractor scrutiny currently hitting medical centers does not exempt allied health. The full written guide is linked below, and if you want to see where your practice sits on the numbers that matter, our free assessment tool for allied health practices takes about 10 minutes. The link's in the description. True Tally Bookkeeping, registered BAS Agent 0 certified, and no silly questions.